Coronavirus cases, as you know, have been spiking all over Arizona, especially in the southern part of our state.
Two of our border counties becoming hotspots for the virus, exploding in numbers. Our Allison Rodriguez went south to find out why these cases are rising sharply and what's being done to slow the spread and keep everyone safe.
Here's part one of ABC 15's new series looking at coronavirus at the border.
Arizona has been thrust into the national spotlight. There has been an explosion of coronavirus cases over the last month, and southern counties Yuma and Santa Cruz along the border are seeing some of the worst spikes.
I don't know that any of us really expected this surge, after the reopening of businesses and relaxing things a bit. I think things have just surged much more rapidly than what we had hoped would occur. And that's alarming. That's really is.
David Rogers heads up Sunset Health Community Center in Yuma County, a federally qualified health center, or FQHC, and he says they're busier than ever.
The phone just rings nonstop. Patients are trying to access testing. Patients are sick. They need to see a provider. Patients need some direction on, what it is they're supposed to do. It just really is overwhelming.
At the end of March, Yuma County was reporting 12 cases of coronavirus. Then in April, it was 6 times that. Now, an explosion. By the end of May, there were more than 1,000 cases, and 3 weeks later, there are more than 4,000. That's a 300% increase in less than a month. For comparison, Maricopa County saw a 42% spike in that same time frame. And it's a similar scenario down in Santa Cruz County, where cases have jumped 328% from the end of May to June 21st.
We started probably about a month and a half ago. We were steady at about 45, 50 cases, and then all of a sudden we started seeing an increase of anywhere from 30 to 50 to 60 cases a day. So that's when we started really heavily looking at the cause or causes at that point.
As of Sunday, Santa Cruz County made up 25.6% of all positive tests in Arizona, the most by far. Especially alarming given that it's one of the smallest counties in the state by size and population.
Well, I'm frustrated because of what I see and what I hear from my constituents. That neighbors are going out, people having parties.
Nogales Mayor Arturo Garino has been increasingly upset by what he says are lack of resources, including tests, and also residents not taking the safety messages seriously.
I've been messaging to the people of Nogales and Santa Cruz County in all the Mexican TVs, radios, newspapers from Nogales, Sonora, Hermosillo, papers from here. Look, I'm with you right now. I've been in Facebook, I've been everything, and I still get people in my constituents saying, "You're not putting the message out there, Mayor." Yes, I am.
As of Sunday, Yuma County accounted for 14% of positive tests across Arizona. This means almost 40% of all Arizona's positive tests are coming from these two border communities. Over the last 10 years, more and more businesses have opened up here along Main Street in Yuma. And as more people get out now, we've noticed about half of them wearing masks, the other half not. That number dropped significantly as we made our way through Nogales and Santa Cruz County. And health experts say the number of cases tend to rise sharply after large gatherings.
One thing we do know that it's been spiking after certain events. It spiked a little for the Easter week. It spiked after Mother's Day, and then then we're expecting the Memorial Day spike, and then we're having a bunch of graduations. The kids graduated and they had their parties.
Both counties are predominantly Latinx, and studies have shown that minority communities are testing positive at a much higher rate. As of Sunday, 26% of all cases were in the Hispanic or Latinx community, 17% white or non-Hispanic, 10% Native American, and 3% African American. Something that sadly doesn't surprise Dr. Edmund Baker, medical director of Equality Health in Phoenix.
When COVID was first identified in China, they said, people that are older, people with these chronic diseases such as liver disease, lung disease, diabetes, are really having worse outcomes. that's when I knew right away that the people here in this country that are going to have worse outcomes would be the ones that have chronic diseases just like that. Chronic illnesses such as diabetes, hypertension, lung disease, all are items which plague underserved communities.
In Yuma County, 63% of the population is Latinx, and they account for 72% of cases as of this past weekend. In Santa Cruz County, 83% of people are Latinx, and they make up 41% of the cases. But we may not know the full extent of how hard these communities are getting hit because the data collected has many gaps. There is a huge hole where race ethnicity data is just unknown, not only in these counties but also across the state. And that's why testing has become so important to health experts in order to really address where the spread is worse and how to mitigate it.
We also have to improve testing. So there has to be a lot of testing, free testing, for all these underserved communities, and we have to do it now. We can't wait.
He says because that's one way the whole state can work together to slow the spread.
We have to remember the state is open. The highways are open. So you may live in an area that doesn't have the same numbers as we do in Phoenix, or not heavily hit like some of the counties like Navajo, Apache, Yuma. But the problem is, people travel between these counties freely.
What's happening in these communities is clear now looking at the data, but the why may hold the key to helping slow the spread and get people help. The location of these counties, the top industries, and the access to more care. And that's what we'll explore in our next story on COVID on the border tomorrow. Reporting for ABC 15 Arizona, I'm Allison Rodriguez.
And every day, Arizona's coronavirus case count just continues to go up and up. We know to our north, the Navajo Nation has been hit especially hard, and now our southern counties have also turned into coronavirus hotspots. Our Allison Rodriguez traveled down to Yuma and Santa Cruz County to see what may be causing that. It's part of our special series, COVID-19 on the Border.
In Arizona, most people know Yuma as the place to fill up on gas on the way to San Diego. It's the 5th most populated county in the state and quickly becoming a hotbed of coronavirus cases.
I think that we're really high right now. I also see that we get huge swings after any kind of event.
Serena Kugel owns a store along Main Street in the city of Yuma.
I do think that, yes, we are a little bit of a hot spot right now. Where are those numbers coming from? I don't know.
Medical experts say those numbers are a result of many different factors that affect Yuma and Santa Cruz counties.
The first thing that people have to understand is poverty is a public health issue. And we know that the higher the poverty rate, the more that patients are susceptible to a lot of the chronic diseases that plague the communities.
Santa Cruz County has a 24.4% poverty rate. The statewide average is 14%. The poverty rate in Yuma County is at 19.5%. And we have seen zip codes in both counties at the top of the list for cases on the Arizona Department of Health Services website.
Those social determinants of health, when combined with socioeconomic status and poverty, it creates the problem of patients not having access, not having the sometimes literacy rates in order to get good medical care.
Equality Health Medical Director Dr. Edmund Baker used to work down in Santa Cruz County at Mariposa Community Health Center.
Down in Nogales, there's another issue. There's not as many doctors available per the amount of people that are down there. So therefore, they have a desert because of lack of access due to not having enough physicians, and also financial reasons and transportation reasons because it's so spread out.
This is the only hospital in Nogales. It only has 25 beds, and it's not equipped to handle more severe cases of coronavirus. So patients have to be taken to Pima County for medical care, about an hour away. Rural communities dealing with healthcare deserts in a time when they need care most.
Last week ran at 140% of our normal capacity, and that's almost exclusively due to people wanting appointments to manage COVID symptoms or potential exposure.
Mariposa COO Daniel Prevo says they've had to open positions to try and keep up with the volume of patients due to coronavirus in Santa Cruz County.
We just don't have enough appointment slots to see all the patients who want to be seen. And it puts a huge, burden not just on the providers, but also the nursing staff and the support staff.
Medical researchers and county officials also believe cross-border traffic could be contributing to the spread.
Workers that cross from our side to work over in Nogales, Sonora, as well as workers from Nogales, Sonora coming here to work in the produce warehouses and other industries. So trying to keep a track of those workers is our hardest challenges. So that we work with the Arizona Department of Health Services Border Health to try to keep track of those workers as well.
Mexico is Arizona's top trading partner, accounting for about 30% of the state's exports to foreign markets. That's according to a study by the University of Arizona. This port of entry here in Nogales is the busiest in all of Arizona, particularly for commercial use. Truck drivers deemed essential during the lockdown, meaning traffic never really stopped here. And cases in Mexico are growing rapidly too. In the border state of Sonora, there are nearly 5,000 cases of COVID-19. But exact numbers are hard to tell after the New York Times found the Mexican government wasn't reporting hundreds, possibly thousands of coronavirus deaths in Mexico City. Meantime, transportation is one of the top industries in Nogales, along with food service and prep. In Yuma County, it's farming and agriculture, all industries that can make social distancing a challenge.
In the communities that are underserved, you find that we're in areas that are high touch. Those that are transportation workers, those that work on farms, those that are in fast food industry. These are high touch areas. We're always around people.
Walking through the Morley Avenue shopping area, many stores are closed due to the recent outbreak, and the few that are open are requiring masks, leaving residents with limited options and having to travel elsewhere if they want to shop.
You gotta understand that we have a lot of the people down here do travel to those areas to do their shopping, for school, clothes for their kids and so forth. So they do travel throughout the state. So it is a concern throughout the state. Whether they come down here from, like, say, Tucson or Phoenix, come down to Nogales even, there is a concern that there is a lot of travel.
All these factors pose unique challenges as we deal with an unprecedented health crisis. And a second wave may be coming. So what can be done to try and slow the spread? How do county and city leaders navigate personal freedoms and public safety measures? We'll explore that tomorrow as we wrap up our look at COVID on the border. Reporting for ABC 15 Arizona, I'm Allison Rodriguez.
Through our special reports surrounding COVID-19 on the border, we've learned how hard our border communities have been hit by the virus. Also looked into what factors play a role in the spike in cases. And in our final installment of this series, Allison Rodriguez looks at what's being done to try and slow the spread and keep communities safe.
The amount of patient encounter has increased significantly.
Dr. Eladio Pereira works at the Mariposa Community Health Center down in Nogales. They have been going nonstop.
It has been like we've never seen before. The number of patients with active disease has increased dramatically.
The main campus is screening patients before they can even come in the building.
It's gonna be in the ear, okay, and I'm gonna give you some Germans, okay?
Everyone has to do it, no exceptions.
Since the first week in March, we decided to make some changes that were very significant, from surgical masking use to procedures to keep our staff safe, implementation of our screening stations.
The health crisis has put a strain not only on them, but all health resources around the state.
Certainly in rural areas like ours, that's magnified because the choices are not the same.
He's worried older patients, the most vulnerable to COVID, won't seek help because they're not familiar with telemedicine, they don't have transportation to the clinic, or because they're frightened.
We're a little concerned that sometimes they don't come to see us because they're concerned about COVID, and certainly rightfully so. But we need to keep in the back of our mind that those patients still need to see us. But they have huge challenges as well.
According to the Arizona Department of Health Services website, people 65 and older make up 75% of deaths across the state. So medical professionals are stressing the importance of things they say we all know to do by now.
My advice to my patients are continue social distancing. I would prefer if there was still a stay-at-home order in place, but since there's not, social distancing has to be our major way of keeping ourselves healthy.
I asked the governor for the exact ways he'd address the issues at our border counties. His office sent me a statement saying they were tracking data along the border and had plans to expand public health education. Though when I asked for specifics, I didn't get any. They also say they're going to ramp up testing, something desperately in short supply in these areas.
Well, we would like to see increased testing down here. We have increased our testing quite a bit. Unfortunately, we were slow to get that testing down here.
Jeff Terrell is the Santa Cruz County Health Director. He says the county is trying to put on testing blitzes, but they need help.
We are trying to work with the state as far as getting some funding, additional funding, to set up some blitzes so we can get that additional testing to hopefully get most of the citizens of Santa Cruz County tested.
Another thing they believe will help Santa Cruz and Yuma counties are masks, especially if you're working in tight groups. The number one industry here in Yuma County is agriculture, and the farm workers who tend to this land often work closely together, leaving little room for social distancing. There's been a COVID outbreak on farms in some Canadian provinces. 3 people have died. All 3 patients were workers from Mexico, and procedures are being looked at to keep them safe.
It spikes so much.
Nogales Mayor Arturo Garino wanted masks mandatory in his city before Governor Doug Ducey gave the go-ahead.
We're going to have to make sure that this is enforced citywide and countywide. And the way I think it should be done, if that's the case when it comes to a mask, it has to be enforced statewide. Because if you have people coming in from Tucson or coming in from Nogales, Sonora, they better understand that they need to wear a mask when they go into a store.
Patients are
CEO of Sunset Health Clinic in Yuma County, David Rogers, agrees masks will be highly effective in slowing the spread.
You know, with the rate of infection and with the surge that's going on, I certainly do not understand why people aren't wearing a mask, because with this type of a virus, it's absolutely the best way to protect yourself is to distance at least 6 feet and to wear a mask.
They are mandatory in certain cities and counties in Arizona, but not statewide, and there's still debate on enforcement. All but one person I spoke to told me they don't believe the state should have a second lockdown. But these medical professionals do all agree washing hands, wearing masks, and social distancing are all anyone can do until this virus is under control.
Well, there's no cure, there's no vaccine, so there's nothing we can immediately do to make this go away. All we can do are the preventive measures like keeping distancing, hands, protective equipment. All those things are things we can do now, but that's, again, not an immediate fix of the problem.
This has been a special look at COVID on the border. Reporting for ABC 15 Arizona, I'm Allison Rodriguez.